Evaluating a patient with hair loss can be very challenging. I think there are essentially two buckets that you really need to sort of separate first: scarring versus non-scarring alopecia. And I think most of us do this on exam. Sometimes a punch biopsy is needed in order to separate those two types of hair loss. Once you know what hair loss you're dealing with, I think it's very helpful to do a hair prep, and I do this commonly in my office, especially if I'm suspecting that somebody has telogen effluvium. I think for many patients with hair loss, whether it's telogen effluvium or androgenetic alopecia, we have to rule out an internal component, whether it's hormonal or maybe something like an iron deficiency. So many patients undergo a laboratory evaluation. Then you have to combine all that data, all that information with your clinical evaluation. I think only then can you really sort of put the complete picture together. And I think with hair loss, perhaps more than some of the other conditions that we treat, getting a very detailed history is very, very important. And that includes such things as patient's nutrition, the history of hair loss itself, any internal conditions that they may have. And I think with this kind of all this information gathering, you can really narrow down the diagnosis and be as precise as possible.